Hello and welcome to the Surface Integrity Specialist Certification Program. This is a customized certification course presented to JaniKing franchise locations by Diversey. So, by way of summary, the problem we are trying to address is that healthcare surfaces are routinely damaged and they create an infection risk for patients and staff. Damaged healthcare surfaces are also not allowed or they're prohibited by surveyors in a healthcare facility. The solution is that Diversey markets the only cost-effective, clinically validated solution called CleanPatch, along with a validated protocol for its use. The opportunity for JaniKing and its franchise locations is that Diversey offers an exclusive certification program to provide a service to implement the solution to address the problem. This service can be certified according to a 3-module program and training, and at the conclusion of this training, JaniKing will be certified Surface Integrity Specialists, or SIS. So the training we're offering today is by way of 3 individual modules. The first module focuses on surface integrity and its importance, its strategic and critical importance for infection prevention. The takeaway of this module is we would hope that JaniKing franchisees would be able to outline the magnitude of the problem in order to properly describe the value of the service to your customer. Module 2 goes over the actual nuts and bolts of the surface integrity assessment, how to run the surface integrity assessment, how to be able to classify damage as repairable or tagged for replacement, and being very familiar with how to use CleanPatch as part of this assessment as your repair solution. And finally, Module 3 will describe the best practices and keys to success. So what we have found works best in order to pitch the assessment, as well as the logistics and follow-up thereafter. So the training today will be organized in these 3 modules. Each module will be 15 to 20 minutes in length, followed by a short quiz at the end of each module in order to move on further. So Module 1, again, focusing on the critical importance of surface integrity in infection prevention. So this picture here was actually taken at a level 1 trauma care, a large hospital, and this is a stretcher with a cracked and damaged corner, and you can see the foam exposed. Hospital staff had tried to apply pink tape to it, and somebody actually jokingly put this message: "The home of MRSA." So I think it's quite commonplace and people are quite knowledgeable that damaged surfaces are dangerous. So I'll just sort of describe this as part of this module. So let's begin with asking a quiz question. Which surfaces do you believe have the highest number of contacts in a patient room? So what surface is being handled or touched more often than anything else in that patient room? Well, the actual answer is bed rails, number 1, and bed surfaces or mattresses. So you can see here this graph. This is a study done by Huselage in 2010, and definitely 1 and 2 are surrounding the bed and mattress. And this makes sense because patients spend a majority of time in their hospital bed. So this really shows you that surfaces are critically important to manage and maintain as part of a facility's infection prevention program. The problem with this is that damage is very common in healthcare. So although it's a soft surface that we need to manage and maintain, damage is commonplace. So the published literature as well as audits have revealed that the damage rate in many U.S. healthcare facilities is 20 to 40%. And again, here are some pictures of the damage we have found in our journey, along with warped and stained mattresses here on the right-hand side, down to a bed. This burgundy bed was actually in critical care, a large rip there. The reality is these surfaces are impossible to clean. There's a tremendous risk of fluid ingress, and they're dangerous. So, we have a large or high damage rate. There are really three reasons for this extensive damage that we see in U.S. healthcare facilities. The first reason is physical damage. So this is mechanical abrasion. So this is mattresses being bumped into walls, sharp objects like needles or buckles, resting and piercing the surface, and also improper storage. We do tend to see heavy, sharp objects being stored on these mattresses when they're not in use. Second of all, we do also see chemical damage, and this is frequent and prolonged and inappropriate cleaning and disinfection chemicals being used on these surfaces. Not only that, is they're typically not used according to manufacturer's instructions. They're not rinsed or allowed to dry. And, not following the manufacturer's instructions can lead to cracking of these vinyl polyurethane surfaces. And lastly, general wear and tear. Mattresses typically have a usage life of 2 to 5 years. We typically find them in circulation well past 5-10 years a lot of times, and the material just weakens over time. So these three reasons are why we see a 20 to 40% damage rate in many institutions today. The problem with this is that when damage is ignored, it can lead to fluid ingress. So this is a real case study that we've been recounted in literature as well as been described to us. A male patient submitted to a clean hospital room, lies on the bed, finds that his backside's wet, lifts the sheet, only to find that blood from inside the foam has now contaminated his hospital gown. And if this is not the biggest nightmare you've ever heard of, I'm not sure what is. So here is a mattress that we've taken a picture of to demonstrate that this does occur. In this hospital's situation, this actually led to a Department of Health survey and a possible lawsuit by the patient. So it's a very severe and critical problem. The reality is that every time a hospital leaves a mattress damaged in a hospital room, this can potentially happen. So it is critically important to maintain our soft surfaces and our mattresses and stretchers at all times. The FDA has also commented on this as early as a couple of months ago, actually. They've been talking about this problem. So they've had over 700 reports or complaints about fluid ingress in mattresses reported directly to them. They've issued safety communications and warnings about this and definitely indicated that damaged mattresses need to be addressed. It's also an issue that's top of mind for the ECRI Institute, a very respected not-for-profit institute on healthcare excellence. So this is an article pulled a couple of months ago where the third issue on their top 10 health technology hazards was the risk about fluid ingress and mattress damage. So it's a very topical, relevant problem in today's healthcare. We have this 20 to 40% damage rate. We have this critical problem in infection control. However, there has not been a good solution to this problem that's both clinically validated and cost-effective to date. And really what hospitals have had to do in the past is buy a new mattress, which, yes, it works, but it's very expensive and it's inconvenient for a very busy and at capacity hospital. Or they try to repair with tape, and that could be duct tape, that could be Tegaderm, that could be skin tape. This is inexpensive, but it's absolutely prohibited by surveyors and really does not work. And I'll show you that in a couple minutes, how this tape just does not function in repairing surfaces. And lastly, do nothing, which is absolutely not an option to consider. So we have a severe problem, and we to date do not have a good solution to that problem. I think the last point I wanted to make in this module is really that surface integrity is critical for infection prevention. So any sort of damage to a soft surface of any kind, whether it be an abrasion, a rip, a tear, a chemical damage, these surfaces cannot be fully disinfected. No matter how good your cleaner is, your disinfectant is, you will not fully render that surface hygienic. So there's definitely a risk of cross-contamination. It is critically important to either repair that surface or to get a new surface in order to deal with this problem. So that is a really important point as we move on. So that concludes Module 1, where we've tried to illustrate the problem as well as the research to support that problem. These are 3 quiz questions I'd like to ask prior to moving on to Module 2. Number 1 is, what is the most frequently touched surface in a patient room? Number 2, explain the 3 main causes of mattress damage. And number 3, what may happen if a healthcare facility ignores damaged mattresses? Okay. So maybe pause the recording now and answer those questions, and we will move on to Module 2. So congratulations, you've answered the quiz questions, and you now have a working understanding of the problem around damage, soft surfaces, and the importance of surface integrity for infection prevention. Now let's take that problem statement that we developed, which will be important to communicate to your customers, and let's talk about the nuts and bolts around conducting a surface integrity assessment in your customers' facilities. So here's an overview. So the surface integrity assessment is a comprehensive approach to inspect, identify, and repair damaged mattresses and stretchers in a customer facility. Now we leave it as a surface integrity assessment because there are other surfaces you can look to repair, but for the purposes of this presentation, we're going to focus on mattresses and stretchers because that's where most of the work has been done. So again, the scope or the goal is to find and assess damaged mattresses, repair the ones that are appropriate according to a specific set of guidelines, or just tag the ones that are not repairable for replacement. And the benefits of this is that this will ensure readiness for accreditation survey. So before a site is being audited, this is something that will get their ducks in a row. It's brand neutral, so we really don't care what mattresses, stretchers, soft surfaces you have or your customer has. We'll assess them all. And it helps identify damage trends. So you may be able to guide your customer into the right type of surfaces or the right type of protocols moving forward for their soft surface maintenance. And most importantly, I think, throughout this process is that you can definitely pass on significant cost savings by repairing instead of having to replace. So we'll give an example of that a little bit later. So the process overview is 4 steps, and I'll focus the Module 2 on describing each of these steps in detail. So number 1 is a manual inspection of the surface in a clinical area and how to do that. Number 2 is an assessment of the damage if found. So once you inspect the surface, if you find damage, how to assess it and categorize it. Number 3 is color coding and intervention of the surfaces. So once you've inspected and assessed the damage, you then need to classify it according to green, yellow, pink, red. Green being intact, no damage found. Yellow being damage was found, repairable with CleanPatch, product we'll be talking about in a few minutes. Pink being damage not repairable, need to replace when possible. And red, which is the most severe, is significant damage found. And this is really a significant risk to the patient, so urgent replacement is required. And lastly, recording of all findings. So we'll now spend some time going through each of these steps. So let's begin with a manual inspection of surfaces in a clinical area. So as we go into our, JaniKing goes into a customer facility and looks to inspect these surfaces. These are the steps that we have found work best. So first of all, pulling back the linens to inspect the mattress. We advise that it's best to kind of pull back the linens 1/2 at a time So it's just easier for you to remake the bed. We do typically do these assessments in a full occupancy or a full capacity hospital. So we will have to navigate the mattresses sometimes with patients on them or near them. So that's important, and we'll talk about the logistics of that in a while. Second of all, as part of the inspection, a visual look to see if there's any signs of fluid ingress. And there's two possible signs of fluid ingress. One would be staining, as I showed in some previous slides, and we'll show in some pictures moving forward. This is a blotching, discoloration of the mattress cover, and it's very visual. You can definitely tell if a mattress has been penetrated with fluid. Or there's warping, so that the mattress cover is not tight and supple, it's kind of bubbling. So those are two signs of fluid ingress. You're also going to inspect the top sides and corners for any visible damage, and that's doing a quick look. We find a flashlight works well here, just to see all those sides and corners. You run your gloved hands over the surface as well to feel for damage, as well as your visual cues. And we also like to look and recommend to look at the underside for tags, just to help you identify the dates, the date or how long it's been in circulation, sorry. So once you find damage, it's important to check for fluid ingress. This is done visually, but if you're unsure whether there's fluid ingress, a second test is called the paper towel test. This is basically folding a paper towel into 4 layers, pushing down into the damaged area with a gloved hand, and looking to see if the paper towel gets wet in any way. If you see any fluid transferring onto the paper towel, this is a good indication that you have fluid ingress. A little hint on the protocol: if you find any fluid ingress, either visually or through the paper towel test, this mattress should be replaced. They should not be repaired under our protocol. If there's no fluid, which the vast majority of the time will be, you can proceed to repair. So that's the inspection of the surface. That's looking for fluid contamination, and that's looking for any damage points as best you can. Now let's assess the damage. So it's very important that you use consistent terminology as you identify damage on these surfaces. And these are kind of all the categories that we have found that we can classify this damage. So there's punctures, which are small holes. There's cuts, which are typically scalpels or clean incisions. There are tears, which are more ragged, so that would indicate something a bit more rough in appearance. Scratches, so hasn't penetrated through the mattress cover yet, but you can definitely see that the material is starting to give way. There's cracking, so we showed a picture of that previously, where all the material in kind of a spider web design is starting to get progressively worse, and that's disinfectant related. Delamination is a step further than cracking, where you actually see the ticking or the white lining exposed. And that is a very dangerous, if it's gotten to that point, it's obviously very dangerous, and fluids can penetrate. Bleaching is when the color is faded. Staining is when, again, you see the fluid ingress. Warping, we've already spoken about as well. Or base damage is when you see damage underneath. So we would indicate, we would recommend that Jani-King puts all of these as part of their checklist and sort of checks off which one they see when they come across it. So we've inspected the surface, we've assessed the damage now. Now that we've kind of classified the damage, we can now move towards intervention. So how are we going to address the damage we have found? Again, there's 4 criteria, all based on different colors. So the colors are relevant because once the assessment has been done and the classification has been made, we would recommend that you take a little tag, and you can see them here. We can provide the file for this. And these tags will be placed on the frame of the bed so that you can track them over time and the hospital can keep an eye on them. So again, the tags, you have the color coding in the top left-hand corner. You have the location of where the bed was, and you have the date of the assessment. Again, to reiterate the 4 colors: green, no damage is found; yellow, damage was found, but it's repairable; Pink, damage is not repairable and you need a replacement sometime in the future. And red is significant damage and urgent replacement. So we'll talk a little bit about the difference between a pink and a red in a future slides. But right now, I just wanted to give you an overview of those 4 color classifications. That's about it for the color coding. So let's move on now. Here are the examples of what a yellow looks like, what a pink looks like, and what a red looks like. So again, yellow are tears, punctures, rips, holes, scratches that are fairly small in nature. And we'll talk about it in a few minutes, but really it's 4 inches or less is the magic number for yellow, for a yellow classification. Pink is when the tear is larger than 4 inches, and it's maybe not on the top surface. It might be a side, it might be a zipper coming out, it might be a base. This is a little subjective, but we would say, in our opinion, it'd be anything that is not on the patient care top surface. Pink would be replaced when possible. Red would be like a delaminated product. You can see here that the mattress cover is completely given way to the ticking, and this is an immediate risk of fluid ingress. This would be on the buttocks region, maybe, or the head region. That needs to be removed out of circulation ASAP. We had to make a pink and a red only because we wanted to identify mattresses that were at very, very high risk for immediate removal. So again, we're going to focus the majority of the time now moving forward on these yellow tagged mattresses, because these are the ones that JaniKing can actively repair on site and save money to the customer. So, how do we repair these mattresses? Well, this is what Diversey offers as a value proposition to JaniKing, which is CleanPatch. CleanPatch is a first-in-class medical surface repair product. It is indicated to mattresses and stretchers, or hospital beds and stretchers. And the claim that we have registered with the FDA is that it restores a damaged mattress to an intact and hygienic state. So it takes a damaged mattress, which is otherwise dangerous to the customer, an infection risk, and it turns it into an intact, cleanable, safe state for patients and staff alike. This is an FDA-registered Class 1 medical device, and we've had positive guidance from Joint Commission CDC. I'll talk about that in a few minutes, and over 1,500 facilities globally implementing and using this technology. So it has been widely used already by a lot of hospitals and healthcare facilities. Here are just a few pictures of the product on both an air loss mattress, a Hillrom mattress, and it just shows you how narrow or low-fitting this product is with the pencil. I'm going to spend some time now focusing on the 3 buzzwords around this, which is clinically validated, simple application, and cost-effective. So first I'll pause for a minute and we can watch the nurse whiteboard video that we created. This sort of tells you our story and kind of gives you an idea of where this whole thing came from. So this was an idea from a nurse who identified a problem, and we developed a solution to address it. I'll quickly pause here as you click this link and watch the video. Hope you enjoyed that video on the story. Now we'll dive into the clinical validation of the product. So again, clinically validated, simple application, and cost-effective. So we'll start with clinically validated. We have completed a significant amount of testing in third-party laboratories as well as hospital partners to prove the following benefits of CleanPatch. It's stress tested, so it withstands and is very durable in a hospital environment. Well over a year in a hospital setting, well over 3 years in a simulated lab test. It's completely cleanable, so you can disinfect CleanPatch, and there's no risk of any bacteria collecting on the edge or surface. That's been confirmed in microbial study. It's impervious or impermeable to fluids, so no blood or bodily fluids will ever pass through CleanPatch, which is critical. and it's very compatible with Diversey's AHP technology, which is obviously the preferred disinfectant for soft surface disinfection and disinfection in hospitals in general. So it very much works with Diversey's disinfectant package. And, you know, having been on the market for a while and been proven, it's starting to be written into many healthcare system guidelines as a standard of care. Here's one example. So definitely is becoming implemented by more and more facilities as we move forward. So moving to simple application, the beautiful thing about the CleanPatch technology is that it's very easy to apply, and it's absolutely safe for handling by JaniKing as well as patients. So I often joke that if you can put a Band-Aid on a finger when you have a cut, you can put a CleanPatch on a mattress when there's a rip. So it is a peel and stick mechanism and very, very simple to apply. Now, we would obviously recommend that CleanPatch in all three sizes be available on supply carts for JaniKing or be available close to the JaniKing franchise locations at all time for easy access. So the 8 steps are as follows. Identify and measure the damaged area. Clean the mattress with AHP technology. Let dry. Remove the white backing from the back of CleanPatch. That's step 3. Step 4 is kind of hold the patch over the damage. Make sure you kind of center the damage around the patch. Step 5 is apply some nice firm pressure to release the patch from the transparent top layer. Number 6 is slowly remove that clear top layer. You want to pull very gently from the arrow down to the point at this step. And then step 7, you basically smooth it, let it sit for a minute, and then clean again, and you're ready to go. You could have patients on that bed within 60 to 90 seconds of you applying the patch, and the adhesive is already building on the surface and is already safe for use. So again, 60 seconds to apply the patch. It's something you can do very, very quickly as part of the surface integrity assessment. So let's do a little test now. So as part of this training, we'd like you to get comfortable with applying CleanPatch in the different sizes as well as in the different circumstances. So application 1, I'd like you to apply a CleanPatch small, which is a 2-inch circle on a flat mattress. And then application 2, applying a CleanPatch medium, which is a 3.5-inch square on kind of a side, as this picture demonstrates, a 2D mattress side. So we can pause the video here and have you apply nice and gently, hopefully following the directions I just walked through. Okay, so moving on, hopefully you were able to apply the CleanPatch successfully. It is fairly straightforward, and after you've applied a couple, you'll get the hang of it. It'll become quite easy to do on scale. So just again showing and giving you kind of an idea of how CleanPatch compares to other technologies that are quote unquote used for repair. This is a video that actually showcases CleanPatch versus 3 types of tape. It's actually quite comical because CleanPatch does so much better than any of these other technologies. So again, we'll pause here and we'll have you click the YouTube link for you to watch this short 1-minute video. All right, so moving along, I think we've now demonstrated the clinical validation of CleanPatch, how to apply, how it stands out against tape. Now let's move to a major benefit, infection control being the first benefit, the second benefit being cost savings, cost efficiencies. So a buzzword I want to stick in your mind and hopefully you can share with your customers as you talk about this service is that 20 repairs cost less than 1 new mattress. So your customer can go and buy 1 new mattress and fix 1 problem, or they can have you come in and apply 20 repairs and fix 20 problems. So we believe there are very few products that have such an immediate and direct impact on cost savings. We have models as well we can share, economic models that you can walk through with your customers. But we find that typically repairing with CleanPatch can save hospitals $40,000 plus with such a simple product like CleanPatch, which is a huge benefit in today's day and age. So moving to regulatory position, this may come up as well as you talk about the service with your sites. From an FDA perspective, this is a registered medical device. So it's absolutely been registered and classified by the FDA as a approved medical device. The Centers for Disease Control, the CDC, has already commented favorably on the use of CleanPatch or a patch in a hospital setting. And basically the message was that a repair solution is possible when there are established protocols governing its usage and that the repair seals the surface to an impermeable state. So CleanPatch does that, repairs and seals the surface, as well as there is an established protocol. And thirdly, Joint Commission Standardization Group have come back and said that they have a standard that specifically states that equipment must be safe and in good repair, and that it is very important that facilities develop a program to decide when mattresses are repaired or replaced, which is basically what the surface integrity program is, which we're talking about today. So I think you should have a lot of confidence that the regulatory position is sound here. So circling back to the surface integrity assessment, so we talked about now these yellow stickered mattresses. These are the ones that can be repaired with CleanPatch. Let's dive into exactly what that means now. So that's this left-handed column. So in order for a mattress to be classified yellow or repairable, the mattress age and condition must be suitable for use. So you're trying to find mattresses that are kind of 2 to 5 years, so still within their window of usage. They're not 10, 15, 20 years old. You want to look for no signs of fluid ingress or contamination, as we talked about previously with the paper towel test. You want to make sure, this is an important one here, you want to make sure that the size of damage is 4 inches or less, and that each area of damage can be covered with a single patch. So you could have several points of damage that are less than 4 inches, but what you don't want to see is like a 6, 7, 8 inch tear. That would mean that it's not repairable. And lastly, again, as I just alluded to, you can use a maximum of 4 to 6 CleanPatch on any single mattress. Okay, that would be our protocol. You can check with the hospital, but that's the protocol that we have found works well. Again, each of these things need to be addressed in order to progress or decide to repair with CleanPatch. Let's go on the right-hand side, the do not use CleanPatch column, which is the red and pinks. Again, mattresses that are outside of their age and their usage age. They are stained or warped. Damage is more than 4 inches. And obviously, if it's more than 4 inches, that means you'd have to overlap patches, and we do not recommend this. And lastly, if there's more than 6 areas of damage, or you need to use more than 6 CleanPatch, at that point it becomes an economic argument, and it's probably just best to flag it for replacement. So hopefully that's pretty clear in terms of when to use CleanPatch in yellow stickered and when not to use CleanPatch in red or pink stickered. So kind of elaborating on what I just said, any punctures can be repaired with our 2-inch circle CleanPatch, which is item number 11,001 as offered by Diversey. Any kind of 2-inch or less crack or tear or damage can be addressed with a 3.5-inch square CleanPatch, which is our item 10,001 offered by Diversey. Or lastly, if the damage is 4 inches, you can use our large, which is 3.5 by 6-inch rectangle, which is item 12,001. So again, we do advise that Jani-King carries all 3 sizes of CleanPatch at all times during these assessments. Last step in these yellow stickered mattresses that are repaired with CleanPatch, we advise you to date and initial the repairs. Maybe you write Jani-King date. That helps you track the patch. It also is good for just demonstrating durability to the hospital, as well as showing that it's an approved repair on the surface. Now, these Sharpie pens do come included with every kit sold by Diversey. So let's do a quick recap on Module 2, the surface integrity assessment. So you're going to inspect the mattress. If you find that the cover is stained or warped, immediately it's a pink or red mattress or a replacement. If you have the visible damage, there's no staining or warping, you then look to do, you look at the measurements. So if the damage is over 4 inches or there's more than 6 damage areas, again, it's pink or red. If the damage is less than 4 inches and there's no signs of fluid ingress, you would tag yellow and apply CleanPatch. We have found in our assessments that it's, anywhere between 70 to 90% of the time will be a yellow mattress. And it really depends on how good the hospital or the healthcare facility has been on managing their mattresses or their surface maintenance. If they've been neglecting it for years and years and years, you may find more pink and reds. If they've been somewhat on top of it, you'll find more yellows and greens. So we've done the inspection, we've assessed the damage, we've color-coded, and we've repaired the ones that can be repaired with CleanPatch. Now let's talk briefly about recording all the findings. So here's an example of a spreadsheet that we can provide you that allows you to kind of track every bed or every surface you look at. So it has the unit, the bed location, the type of surface, the model, the damage type, again, what it's color-coded as. We like to include photos if at all possible, so you can kind of prove to your hospital that you're repairing the damage. It makes for a good report at the end. And then obviously what CleanPatches you've used along the way. We've had some good success as well with creating a simple tracking app, which we can help JaniKing set up as well. Very, very simple, relatively inexpensive software. So that concludes Module 2. Let's ask the quiz questions now. Number 1, what are the 4 colors used for assessing a damaged surface? Number 2, explain CleanPatch. What is its value proposition? And then number 3, fill in the following chart. So here's 5 situations where we would like you to put what color it would fall into, and then what intervention. Would it be a replace or a repair? And actually, the bonus points would be which size of CleanPatch you would use. Well, I guess in anyone where there's measurements included. All right, I will pause here quickly. You can put me on pause. We can go through these answers, and then we'll move on to the final module. Okay. Excellent. Let's move on to Module 3. Congratulations, you've completed 2 out of 3 modules. We're now moving to the last and shortest module, which is the best practices and keys to success. So we wanted to provide a few recommendations that may help JaniKing actually attract customers into providing a surface integrity assessment. So the first thing that we think would go a long way is to actually provide a free surface integrity overview. So this is really no different than the brake inspection of the mechanic. So the free brake inspection gets the car into the shop, allows you to pop open the hood and determine, other problems that the car may face, so that you can sell a suite of services to that consumer. What you're doing here is you're actually going into the hospital, you're looking at a percentage of their surfaces ahead of time, and you're hopefully finding some damage, and you're maybe even repairing one mattress with CleanPatch to talk about the value of this service. So if logistically, if you're in the same city as many of these hospitals, if they're already current customers, this should be fairly easy to do, especially if you already have the relationships. We would definitely recommend you focus on high turnover departments. Our experience is that the emergency room and the operating room are the highest rates of damage, and stretchers are fairly easy to get a look at because they can be unoccupied. So look at those. Maybe you look at 10 or 15 of those surfaces, and immediately upon finding damage, if it's classified as yellow, you put a CleanPatch on, and you mentioned that you just saved that hospital $600 in replacement fee. That should turn some heads. And then, that's where I think you could go back with a full proposal to say, JaniKing could come in and do the entire site. Second recommendation that we find works really well is that if you focus with customers nearing surveys. So customers nearing a Joint Commission audit or a CMS review will have a higher sense of urgency to do a full mattress or full surface blitz. And we know this because we have experience. We have hospitals and facilities that call us and need product overnight. So again, I think if you can focus on customers who are within 4 to 6 months of a survey, they will likely convert a lot easier and quicker than one who just completed a survey. We can definitely provide JaniKing with a list of facilities in your area that are nearing a survey. So give you kind of a hot list of customers to call. And at this point, you can also discuss some sort of reoccurring service to come in and do this on a quarterly or annual basis to keep on top of it. Okay, so that's recommendations. Let's talk about 3 or 4 best practices. So obviously, good infection control practices are critical as you do these assessments. Proper hand hygiene is very important. So using alcohol hand rub, putting on individual gloves, new gloves every time you do a mattress inspection, removing gloves, following any PPE requirements if needed, gown up if required, things like that. Obviously, removing patient belongings, keeping them in the same patient area, and following CleanPatch instructions. So making sure you disinfect surface before and after application. These are just good practices as you enter a healthcare facility. Logistics around assessment times. So again, you'd be likely in a full occupancy situation. So we find that going into the operating room and day clinics, either late afternoon or evening are best when the ORs or the clinics are quieter or shut down. The emergency department can be very unpredictable, but if you go early morning, first thing, they're typically a little bit quieter. We also find if you can coordinate with discharge cleaning staff, this helps. They sometimes can give you a pager to and show you when there's an unoccupied bed. Inpatients, again, between meals and after morning care, and surgical inpatient units early in the day. They're going to the OR. So again, it's best also to confirm the date and time that each manager would like you to come, just so that you're not a surprise to them. Bedside engagement, I think, is also important. Again, you'll be dealing with patients much of the time. If you just look at unoccupied beds, there's no way you'll hit all of the different surfaces. So we find that obviously the holy grail or the ideal situation is that they're empty or unoccupied. That's when you get in and quickly do an assessment. But if the patient is in bed and is mobile, you would just ask the RN, or if you're comfortable, ask the patient to get out of bed in order to quickly inspect the mattress. We obviously don't want to cause the patients any discomfort. If they're sleeping or unwell, you could try to come back later. There's a list of supplies needed. So a cart is helpful. Obviously, contacts inside the healthcare facility to call. A key champion within the hospital or the healthcare facility that can help you is always very important. Pens, laptop, obviously the stickers, the color-coded stickers. CleanPatch in all 3 sizes, very critical. You never know when you're going to find, large or small damage. User guides, pagers, cleaning wipes, trash bags. We do offer some training materials that come with every box purchase from Diversey that you'll have access to as well. So I'm going to leave you with this slide. This is an example of a real surface integrity assessment that was conducted on a relatively new hospital. It was a hospital that had only been open for 5 years. So you wouldn't expect high damage rate, but we found a fairly consistent, frequent damage rate anyways. So here you have beds at a 17% damage rate and stretchers at a 23% damage rate. As I alluded to before, it's anywhere between 70 to 90% of yellow stickered or repaired damage. Here you have a bit higher, so 86 to 96% of the damage found could be repaired. And at the end of the day, 84 mattresses were repaired that didn't have to be replaced, which was a total cost avoidance of $45,000. That is a real number for a hospital, and should take turn some heads. Excuse me. So, additional resources, obviously Diversey and Diversey's partner Surface Medical, which is the manufacturer of CleanPatch, are available to assist you in many different ways. So we would advise you to get in touch with us, but we can definitely shadow you on some of your first assessments. We can train you or provide you additional training over these modules. We can develop marketing materials with you and move forward that way. So to conclude, we have 3 questions. What are the 2 key recommendations that may help you land a surface integrity assessment? Explain the bedside manner. So how do you deal with patients who may or may not be in and around their bed? And name 3 supplies of that long list that you need to conduct an assessment. I'll pause now for this final module and for you to answer these questions. So congratulations, you have now succeeded in being trained in a 3-module program and conducting a surface integrity assessment. You are now a surface integrity specialist in SIS, and we look forward to working with you as you move forward with this program in presenting it to your customers. Thank you very much.